Hello, everyone. Hope everyone had a great Mother's Day. I know I did. Well, now we're getting ready for Father's Day in June, and the topic we have is appropriate. While we're talking about fertility, but in this particular case, we're going to focus on men's fertility. So that's why we have Dr. Miller. She is one of the leading acupuncturists, licensed acupuncturists in the country, focusing on fertility. Welcome, Dr. Miller.
Hi, thank you very much for having me. I'm so excited to chat with you again and to talk with the audience about this great topic.
Great. Let's just get going. So let's just understand in the men's section, what happens? Why do they have fertility issues?
Oh gosh, that's such a great question. So I specialize in treating women's health and fertility, but there's not a lot of discussion about men and what their role is, and when it's a really big role in especially natural conception. Sometimes, you know, it's still a big topic even if you're going into IVF, simply because that portion is super important. Statistics will say now that miscarriages, unfortunately, are 25% of all pregnancies, which is a lot. And statistics are also showing that as a result, the male factor is now 40% of that causation. So we really have to focus on what's happening with men's health. We need to talk about semen health. We need to talk about all the parameters and lifestyle and nutrition of the guy just as much as we do of the female, because it does take those two, right, to make a nice healthy baby.
Okay, so now when you when you consult your clients, right, and the couple comes in, so what are you telling the men and the women? What is the difference? Right. You can kind of educate everyone.
Right. In my practice, I do specialize in treating both couples. Right. In our, we have a comprehensive care plan for fertility, and I chat with both couples at the same time in talking about and reviewing their medical health, as well as any kind of family history that could be any kind of key indicators. And we talk about what kind of lab testing has been performed, if any. And a lot of times these couples have been trying for a long period of time, whether or not it's been 6 months or 12 months or 18 months, and whether or not they've actually been able to conceive, and or whether or not there's been a history of miscarriage. So I take all that information and I really dial into both of the partner's health. So we talk about the men, right? We talk about how important nutrition is. We talk about how important lifestyle is. So we talk about, you know, how heat affects everything. And it's well known, right? That's a pretty common thing to know, especially if you're in the fertility world, is to not overheat the testicular area, right? But we also have to talk about like lifestyle and work and jobs. A lot of men have jobs that require them to maybe work outside, right? So how to get around that, and what other things that can be done that can optimize their health. And a lot of couples will perk up when I say that the good news about men generally, unless there's a genetic factor that isn't discovered yet, is it's only 90 days to turn that around. It's really quickly. Men have new product every 72 to 90 days. So there are things that can be done to optimize how well their sperm is produced and how healthy that sperm is. And as the health of that embryo is as the health of the egg as well as the sperm. So if the sperm isn't as healthy, right, that embryo is not going to flourish.
Okay, so it's a very interesting topic. How do you figure out the health of the sperm? Are there some testing that you do before
Yes.
and after or during the process? I mean, what does that look like?
Yes, absolutely. So I do recommend all couples that come in to have a semen analysis. And that's a pretty quick and easy test that the guys can do. So the women, they have like a list of testing that they, you know, are going through, but the guys, it's just one test that they're really doing. It could be an extensive test that add in, but it's just going to be the semen analysis that looks at the quantity, right? The volume. It's going to look at the motility, how well those semen swim, and then the morphology. And the morphology gets into genetics, and that's the shape of the sperm. So when any of those parameters are out of the normal ranges, then we work on that. And acupuncture is really fantastic at doing that. But so is taking nutritional supplements as well as lifestyle. So putting these all three together for the 3 months is going to turn that around. And then there's other tests that I look at, if there's testing for, hormone levels, sex hormone levels, as well as vitamin D is super important, as well as vitamin B12. So we do fine tune that stuff. And especially if they don't have that testing, then I send them out for that too.
Okay, so let's just talk about acupuncture. You said, are we talking acupuncture and also Chinese herbs along with the lifestyle, along with the diet? Let's just talk about this whole.
Sure. Yeah. So in our comprehensive care plan, it just depends on what the couple's dealing with, right? Depends on what the struggles are. But generally speaking, the fellas, they will receive one acupuncture treatment a week for the 12 weeks. And those are all focused on boosting up the body's immune system, as well as boosting up the body's ability to detox quicker and better, and just getting the body healthy and really concentrating on, balancing those sex hormones. And then there's also Chinese herbs, and those are never the same formula for men across the board. So that's all a differential pattern, depends on what that person is dealing with and what they show up with as to what that formulation is going to consist of. And then we do talk about nutrition. So nutrition is such a key, and I do talk about that even in my platforms. Is the first thing that you can do is drink clean water and eat the healthiest that you can. So like fresh foods, right? So get away from the packaged foods, right? Get away from fast foods and just eat cleaner, fresher foods. And that's going to turn things around so quickly. And then the last thing is going to be lifestyle, right? So we already talked about the heat, like no sauna, no hot tub. Statistics are now saying the hot tub is the worst that you can do. And if you stop using hot tubs within 2 months, that's going to build up the quantity 400%. So that's incredible. Saunas aren't as terrible to the health, but it's just not a great idea, right? So if you're in the fertility world, just stop doing any kind of heat producing things, especially to that area, the testicular area, and that just automatically turns things around pretty quickly. And then last thing is plastics. That's also, I can get on a pretty big soapbox about that. So you want to clean up any kind of environmental toxins. So, right, get rid of any kind of plastic containers that you're eating food out of, and maybe not use as much products that have negative exotoxins. So we do talk about that too. So sometimes men will have jobs that are around lots of chemicals. So we have to talk about what that looks like.
So basically, it's a detoxing your mind, body, and soul before you're thinking of, conceiving.
Absolutely. It's definitely trying to make that soil the most healthiest soil before you plant the seed. And that's probably one of the most common thought process for acupuncturists that specialize in fertility. So get prepared, get as optimized and as healthy as you can before that conception happens, and that leads to a more viable pregnancy as well as a healthier baby. And that's what we're all talking about, not just that positive pregnancy test, right? Once that positive pregnancy test happens, then we have to talk about how to then keep the woman pregnant, as well as have a happy, healthy baby. So, and that all comes back to the health of the egg, the health of the sperm.
Absolutely. Well, this is a quick 10-minute session that we wanted to bring. Anything else you'd like to add before we wrap up today, Dr. Miller?
Oh gosh, I just think that really the quickest and easiest things that you can do for yourself and your health overall is just going to be drinking more clean water, eating healthier foods, and sleeping 8 hours a night. Those are pretty quick and easy things that you can do. And
the stress part, right?
Right. How did I miss that? Of course, dialing down stress, of course. So the higher the cortisol, then the lower the hormone response is going to be. So definitely finding stress relieving techniques. It can be exercise, that can be meditation, that can be so many other things, including acupuncture and or massage. So definitely want to dial that down too, kind of get out of your head so much and just relax. It's certainly very helpful.
All right. Well, thank you so much. Monday morning, everyone. We're just waking up, but this is a great topic for us to wake us all of us. So with that, thank you everyone for the support, continued support. Our app is coming up. this month. We are releasing our brand new website, so stay tuned. And thank you so much for your support. Thank you, Dr. Miller, for being with me.
Thank you so much. Happy Monday.
Thank you. Happy Monday.